Hello, my name is David Briones Fajardo. Topic: Pet therapy, provided benefits, and social interaction and learning in children with autism disorder.
Animals can be helpful to me. A social story by the Shandy Clinic. Animals are wonderful. Not only can they be cute and cuddly, they can serve important jobs. Some specially trained dogs help guide people who cannot see, open doors for people who cannot walk, or bring emotional comfort to people. Some specially trained dogs work at the Shandy Clinic to help children in their therapy sessions. Dogs and animals can be helpful to me by simply being around. Some days I may feel stressed and anxious. Spending time with animals helps to calm my body down by lowering my heart rate, blood pressure, and helping me take deep breaths. Some days I may feel distracted and have a hard time working. Animals can help me feel motivated and focus longer. Some days I may feel like not talking to anyone. By spending time with animals that feel safe, I can learn social skills like eye contact and having a conversation. Animals help some children at the Shandy Clinic complete obstacle courses, learn daily living skills, and tolerate different sounds and textures. Animals can help me become more responsible, confident, and calm just by being a part of my life. I am so grateful for the animals in my life.
Definition: It's the professional, emotional, and psychological intervention. It's which a pet is integral part of a program to spontaneously improve the social and cognitive health of a patient with autism disorder. These processes should be led in the healthcare professional.
Hi there, I am Wally. You may be wondering what I'm doing here. Well, let me start again. I am Wally and I am autistic. For those of you who are not familiar with this term, autistic is a person who suffers from a neurobehavioral condition called autism. But what exactly is autism? Well, it can be a tricky question because autism can be a lot of things. This condition is now being referred to as autism spectrum dysfunction because of its variety and diversity of symptoms. Quite possibly, my autism may be different from another autistic, and that his or her autism may also be different from another autistic, and so on. However, there are three basic symptoms that are observed in all types of autism. Social interaction challenges, deviant responsiveness and difficulty in communication, cognitive dysfunction and insensitivity or oversensitivity to certain stimuli including sight, hearing, smell, taste and touch, tendency to engage in repetitive behaviour throughout life on a daily basis. It may involve pacing, head rocking and hand flipping, etc. Now, let me evaluate myself according to these symptoms. I've never felt comfortable in social circles. I don't go out with friends or in gatherings, even though I have nothing else to do, and usually I feel out of place and panic in social gatherings. So, first symptom, check. I have trouble assessing how my words or actions will affect the other person psychologically. I have a really bad reputation for being blunt, and quite frankly, I have no idea why my words can hurt people. Most people tell me that I don't respond when I'm spoken to. I know that they're talking to me, but I feel a lot of background noise, which makes it hard for me to focus on one point during conversations with multiple stimuli involved. Along with that, sometimes I cannot assess the hidden meanings in conversations. For example, if I'm asked to take my seat, I would pick up my seat and ask, where to? So, second symptom, check. Since my childhood, I have a strong tendency for head rocking side to side. It calms me down. I have these episodes daily and quite often multiple times in the same day. So third symptom, big check. Enough about me. Let's go through some important facts about autism. Autism is known to affect 1 in every 60 individuals, with boys at 5 times more risk to be autistic than girls. Quick question. Do you think the dominance of autism in males has something to do with their gender, more specifically with the Y chromosome? What causes autism is still unknown. It is believed that a cocktail of genetic, environmental, and psychological factors contributes towards autism. Autism is broadly divided into 3 major types. Classical or Kanner's autism, often referred to as severe autism. This type usually covers the low-functioning autism. In this case, autistics have the same but more severe symptoms, along with certain other developmental disorders. A very low IQ, loss of cognition, speech, antisocial behaviours and mental retardation in extreme cases. Asperger's syndrome, also called as high-function autism, tends to have the basic symptoms but with low severity, so that the individuals suffering from it have a very good chance of a normal life. Asperger's syndrome has known to be associated with high levels of IQ, with individuals that may lag in certain daily races of life, but are super smart at stuff that appears to be very difficult for smart but non-autistic individuals. These excellency may include problems in science, art, math and music, to name a few. Can you imagine someone who got the highest score in SATs twice, but can't ride a bicycle properly, and gets confused in easy tasks, like opening a push or pull door? The third type, also known as pervasive development disorder, or atypical autism. It usually involves more sociological and behavioural associated deviations, and is a rather less studied type of autism.
Application on physiotherapy. Tolerance to longer therapies. Improvement in family interaction. Response to simple command. And improvement in attention to body language and others.
A bright sunny day in rural Licking County. And at the Edgewood Equestrian Program, a busy day begins. These are the therapists.
You want a treat? You do? Say yes.
And their patients are children with special needs, many on the autism spectrum.
We're a traditional riding program, but the autistic kids that come here aren't required to ride, but all of them have. And all of them have almost immediately.
Lynn and Russ Edgington are the heart of the Pegasus program. The goal is communication with horses as the teachers. Andy Wilmore has been coming here for 6 years.
Keep on going. Yeah, there's no stopping right here.
And has found relief for his Asperger's symptoms.
The horse can put you at ease. You can help with the horse at ease just by thinking and how that thought translates into the body.
What do you love about this horse?
She takes care of me.
Indeed she does. So what is it about the horses, the setting, the moment?
I absolutely am a believer that horses are magical. They're super sensitive. The feelings, the energy, something that transpires between the horse and the person is beyond words.
Think of yourself as a team with these horses?
Yes, there is a mutuality to it. There is a bonding between the rider and the horse. And that takes time to grow, but it's really, really worth it.
Pros account of equine therapy. Pros. Equine therapy encourages the shield, the word in their hands, exercise, and connect with the animal, transmit it and stimulate tactile sensor and perception. the transmission of robotic impulse with movement and transition of their dimensions, locomotion, improving gait and coordination of movement. No negative effects of the kinesiotherapy are reported for children. However, the must be animals adapted to have contact with children. To have domestic animals not very tall and sensitive.
Thank you, Dave. Many of us can claim a special bond with an animal or pet, but it's that bond that is helping many young children overcome their disabilities. News 10's Patsy Kelly explains.
Can you say walk on?
Walk on.
All right, here we go.
Christian chattered on and on about being Wolverine for Halloween at school on Friday. It's hard to believe he barely spoke 3 years ago, and now he can't seem to stop talking.
Good job. Yeah.
Move on.
He's just one of the success stories at Bright Hope Riders.
One of our famous students was mute. It wasn't that he couldn't talk, he wouldn't talk. He had mental difficulty, and we got him out there, and we go around barrels and get different colored barrels, and I told him to take his horse over there to the green barrel, and he just as plainly said, green barrel. And there wasn't a dry eye in the place.
Look right up between his ears, right here.
That's Dr. Jerry Mansfield. He owns Bright Hope Riders. Bright Hope Riders is a nonprofit organization that helps people with special needs. He says there's a certain bond between a horse and its rider.
They're all a jitter when they're in the car when they get here, and they walk up to the barn, and a little bit of it's gone, and then they see the horses, and all of those things seem to drop away. And they get on the horse and they sing us songs, and they do all sorts of wonderful things.
Mansfield says that bond helps people with mental and physical disabilities. He picks each horse specifically for each rider.
It's really a joy to work with them and to see them progress, and it really does help. It really does.
A program helping Christian and people just like him overcome life's obstacles. In Terre Haute with Chief Photojournalist Mike Latta.
All right.
Patsy Kelly, News 10.
And for more information on Bright Hope Riders or to make a donation, you can head to our website, WTHITV.com.
Application in Ecuador. In Ecuador, the unit with the longest time for 60 yards in the unit of equestrian and remonta of the National Police. It offers equine therapy service for free, an alternative therapy to raise self-esteem and stronger motor skills children with autism.
Hi, my name is Rico Winston. My son Israel was diagnosed with autism at the age of 2. We are part of the SPARK study. SPARK and I are committed to improving Israel's life. I want to share some tips with you. 5 things a dad can do to help their child with autism. Tip 1, start early. I saw signs early on. Israel would do a rocking motion continuously back and forth, as well as line his toys up as he was playing. I was one of the fathers that thought that it would initially work its way out, but it won't. It takes early intervention. I didn't want to say later on, I wish I had done this to help my child. Tip 2, be involved. Do everything you can now, and the rewards will come. When we first got the diagnosis, I wasn't as engaged as I should have been. I was working a lot. If you want to raise a strong child, you have to set that example. Children want and need their father's love. Tip 3, find what works. Israel does not like dogs or cats, but he will pet a horse. Now he's riding, and that's a part of his therapy. Each individual is different. There is no template for what to do with autism. 4, do the research. I come from a family of educators. We research everything. What resources are available to enhance his life? How do I explain to him that he learns a little differently? Once we know the contributing factors, we can do something about it. Tip 5, join Spark. The Spark study is something I can do today. We shared our saliva and our information. A lot of men are going to worry about what their DNA is used for, and I did too. Privacy is imperative to Spark. Researchers use the information to understand actual biology. What you do today will propel you and your child into the future. It will make a difference in Israel's future and the future of other children.
Conclusion. Among animal therapies, equine therapy is the most widely used technique and usage of that offers the greatest benefits and social interaction and learning in children with autism disorder. It is not as good. However, it represents an alternative in this treatment that combined with clinical treatment, especially in early diagnosis, guarantees a better socialization in the individual and therefore a better quality of life.